Welcome to Recovery with Root, a podcast centered on topics surrounding mental health and addiction. Through our Advanced Recovery Institute, a new entity of the Root Center for Advanced Recovery, we are committed to research and training to elevate clinical care. We hope you find this podcast informative, and most of all, we hope that it helps improve the lives of others. Remember, we're in this together, and recovery is possible. Welcome back to another episode of Recovery with Root. My name is Margot Farrell, Chief of Staff here at the Root Center for Advanced Recovery. Very excited today to have Maryellen Shuckerow, the Executive Director of St. Vincent de Paul of Middletown, joining us today. Now, that may sound familiar because we've been posting a lot on social media about our first ever charity golf tournament to benefit just that, St. Vincent de Paul of Middletown. Maryellen, thanks so much for being here today.
Thanks for having me, Margot. It's great to come out to your offices in Manchester.
Absolutely. We're so excited to have you here, not only to talk about the golf tournament, just so that, folks have an idea if they're donating, they're sponsoring, they're playing, and they're thinking, well, where's this money going to? And who is St. Vincent de Paul and what do they do? So give us a little background on yourself and how you found your way to SVDM.
Sure. It's actually my second stint at St. Vincent's. I was a Sister of Mercy for more than a decade, and I worked there in the 1990s into 2000 as their fundraiser in the development department. And then I went up to Hartford and worked at the Chrysalis Center, which is an agency you would know well. I was on their leadership team for almost 17 and a half years. So I'm at the swan song of my career. The opportunity came to come back and lead St. Vincent. So I just started my 7th year as the executive director. And we are sponsored by the Diocese of Norwich, a Catholic institution. We've been in Middletown on Main Street for 45 years, providing what I call safety net basic needs services. So we have a soup kitchen, we have Amazing Grace Food Pantry, which is the largest client choice fresh food pantry in Connecticut. That's on Stack Street. We serve about 1,000 families there a month, as well as we have a full school backpack program. We're in 8 elementary schools and the high school, serving 1,000 children a week through the school year to bring healthy food home for the weekend. The third leg of our agency is pretty big now too. It's to address homelessness. We see a lot of homeless, and unfortunately there's probably more homeless than I've seen in 30 years right now. People literally living on the street. So we do supportive housing. We have 128 units of housing that we case manage. Some is in partnership with other providers. And then we have 51 units where we rent apartments in the community. So we have housing case managers. We have a homeless specialist. And really in Middletown, when someone is homeless or something has interrupted their life in a crisis, we're the first place they come. They get to know us, and then we triage out from the soup kitchen, whether it's clinical mental health services, whether it's clinical addiction services, homelessness, imminent homelessness, meaning they're going to lose their homes for whatever reason. So we're sort of that one-stop shop where people come to address whatever crisis they're in, and then we partner with, lots of people, including the Root Center. I think I certainly was proactive when Stephen was getting his zoning approval to come into Middletown, and that's been a game changer for our folks that are struggling with substance use disorder. If they were on methadone prior to you being in Middletown, they would have to go to New Britain and Hartford, get on different buses, get a medical lift, which aren't always as dependable as we'd like. And so, maintaining their methadone was difficult because of the travel involved from Middletown to other communities to get it. So having it on Washington Street has been a game changer for our people that we serve, that they can walk there. And so they're much more apt to stay with the treatment, get better, and build their lives back from there.
Yeah, no, and for folks who may not know, so we opened up our Middletown clinic now. It's been about a year and a half. We had another clinic in Middletown, but that one did not have methadone. That one focuses more on our adolescent and mental health services. But you were, as you said, a huge advocate, which was so amazing. And one of the reasons that we wanted to select St. Vincent de Paul to be a beneficiary to bring methadone to Middlesex County. I mean, previously it was a zoning law, planning and zoning law, that they were not allowed to have methadone clinics within city limits, which was, just downright discriminatory. Talk a little bit about why it was important to you to speak on our behalf and to speak on behalf of the patients and really the clientele that you serve.
The opioid crisis, when I was at St. Vincent's in the 90s and 2000s, and even a little prior to that, alcoholism was the primary issue we would see amongst people with substance use disorder. Today, alcohol is the lesser of the issue, and opiates is just incredibly strong. And I think it's also incredibly available to get opiates. And so you have low-level, what I call drug dealers, coming into our communities and just getting people hooked, and then, you have the overdoses because it's laced with fentanyl or xylazine. And so we've had a very much of a change in our soup kitchen clientele who have substance use disorder. The other thing it does more so that I see is aggressive behaviors. It creates aggressive behaviors when someone is really into an opioid addiction. And so having you folks in Middletown in a walkable distance with methadone is a game changer. And unfortunately, everybody thought, a methadone clinic, we're going to have people standing outside, we're going to have, all kinds of disruption. And I drive by your clinic all the time, all times of day. There's never anyone outside. There's no disruption of, cars or anything whatsoever. So it's really been a really important, I think, anchor to treatment in Middletown that is really helping people.
Have you noticed a difference in the folks who do struggle with substance use disorder and utilize your services? Have you noticed them being more receptive or maybe
Yes.
More open to going and get treatment?
Mm-hmm. Yeah, because it's available. They can get there. Our go-tos are Rushford, certainly your outpatient, and Merritt Hall, which is operated by Connecticut Valley Hospital. So those are our treatment facilities. And then behavioral health is both River Valley Services and the hospital, Middlesex Behavioral Health. So all of these partners and we rely on and partner with, because we're not a clinical provider. We're a case management, basic needs provider. So while people come to us, we have to make those connections so that people get the clinical side of treatment that's so important, and it's important for the mental health side as well. There's a lot of folks we see either homeless or on the cusp of homelessness that have prolonged untreated mental health issues. And as you know, hospitals are at bed capacity, our shelters are at capacity, so it's kind of the perfect storm right now. Housing is so expensive. When I first started, I pay about 15 rents direct from my office every month, and when I came they were like $800, $900. I'm paying up to $1,450 for a one-bedroom apartment in some of our supportive housing where I have the rental assistance money. And so, and then double or triple security deposits. So my security deposits can be $3,000. A lot of people, even people that are working full-time, can't afford that. And so we work with our coordinated access network throughout Department of Housing to come up with security deposits to help people. Some people just need that push to get into an apartment they're working or they can be working, and they can make it after that. But if something happens where they've lost that housing by loss of a job, lost to addiction, or they've had a mental health break, it's really hard to get back on track, given the amount of money you need to get an apartment to live. So that's sort of our challenges now, and why I think we have more homeless on the streets. I'm sure you're seeing it here in Manchester. You're seeing it across the country. And housing stock is just short and very expensive.
Well, and you made mention to a little bit, folks who may be homeless or may be becoming homeless very soon. I think in the world of addiction and mental health, we've talked all the time about how there's a lot of discrimination, a lot of stigma. I think the same goes for folks who are homeless, and just as much as mental health or addiction can plague anybody and everybody, homelessness, I think there's a lot of discrimination, also misconception that sometimes the average maybe the person that comes to mind who you think may be suffering from homelessness or maybe suffering from food insecurity may not be who it actually is in all reality. Can you talk a little bit about, who those people are who come through your doors? Sometimes it's our very own neighbors, our family, our friends who are the ones who are struggling. It may not be what you stereotypically think.
Mm-hmm. Last winter, we had a young woman living out of her car, and she gave up her daughter to her sister. She was working 2 jobs, but had split up with her partner, and so she lost the apartment, and her sister took her daughter so she could stay in the same school district. So she was someone we helped with getting an apartment, getting her set up with a security deposit, got her daughter back, and she's working her jobs, and she's fine. So she didn't have a lot of financial support she could get from family, but she made sure her daughter was taken care of, and she literally was sleeping in her car in the middle of winter. She was probably under 30 years old. So we got her very quickly because she was able to work out of that situation. A lot of what I see right now, we have some elderly homeless individuals who are very treatment resistant with severe mental illness. Paranoid schizophrenic, personality disorder, and we just can't get them to adhere to mental health care, and it just exacerbates why they're living on the streets. Those are the folks that worry me because they're getting older. Everybody thinks that the winter is the worst for homeless people. The summer is just as bad. Your body breaks down differently, living out in the heat, in the moisture, in the cold. Obviously, that's really bad too. You can die from that, but you can also see in the summer people have health issues, they have wound issues due to heat related, being outside. And we've got people living in the woods, we've got people living by the river. So we work really hard to address that and get people as best we can into shelter and housing.
What would you say are some of your biggest barriers that you run into being a nonprofit and in the work that you do? What are some of the biggest struggles that you guys face?
I think right now our biggest worries are our federal funding. So we don't have federal funding in our soup kitchen or Amazing Grace Food Pantry. Those are pretty much private foundations and a host of businesses and donors that keep those. They're both $500,000 programs. Our supportive housing is funded by the government and by the state. I'm not so worried about our state funding, but we just don't know year to year if that federal funding is going to come through. So I think with the administration in Washington right now, it's an added worry. And I think, you being a healthcare provider, you're dealing with the same things. And, drastic cuts to Medicaid, drastic cuts to the HUD programs, our streets would be teeming with people. And I think that's my worry. When you think about it, every senior housing complex is funded through an 811 or a HUD project. So that's my worry, that making drastic changes to proven programs, harm reduction programs, in sort of a fell swoop, could really wreak havoc in our communities, in our network of care providers, ability to serve people, and keep moving the needle in a positive direction.
What do you think people can do if they're listening to this at home and they say, how can I help? Maybe they're not in Middletown, but these problems persist everywhere. It's not just Middletown, it's not just Manchester. As you said, it's across the state, across the country. If someone's listening to this and they want to help, what are some ways that you think people can just do something to make the world a little bit better when it comes to these types of issues that we're facing?
I think talking to our congressional body is important. I stay very close to Senator Murphy's office, but making your concerns heard to our congressional leaders is important because they're the ones fighting for us in Washington. I think volunteering in any nonprofit is really important right now. And I think donating to your nonprofit of choice is really important right now because it's the will of the people that will keep us going. And, that $50 donation or that $20 donation, multiply that and multiply that, it keeps us going. And summer's our low spot for finances, so having the golf tournament in September really helps us. But I need as much donation in the summer as I do at Christmas time. Christmas time, we get flooded between Thanksgiving and Christmas with food and money, but I've got to make us through the summer, which is the same kind of issues we're dealing with that we're dealing with in the winter. We also run an overflow shelter. So we run a warming center from December 1 to April 1. When the shelters are full in our communities, we provide a 40-bed overnight shelter 7 days a week for those months. And those are life-saving. And they're expensive to run. And so I think anyone that is interested in helping any nonprofit right now, it's with your willpower, with your financial means as you can. And if you can volunteer, that's a great thing, because our agency we only have a staff of 23, and that includes me. So we rely on, to run Amazing Grace for one day, takes 25 volunteers, and we're blessed. We shop people 3 days a week. We're one of the few pantries that allows families to shop every 15 days. So with the proposed cuts coming to food stamps, that could hit us very hard as a wave. And most of our families at Amazing Grace are working, double parents working 2 jobs, most on food stamps, still struggling with raising their kids, paying for their housing and their cars and everything. So they need that bump. And it's a great environment to volunteer in. The soup kitchen has volunteers every day. So we run about 500 volunteers through our programs every year. And we try to give back to our volunteers that it's a really positive experience. And our donors are really important to us. And I think in this economy, to hold on to your donors and build your donors is going to be very effective in combating whatever cuts we might be getting from the federal plan.
Well, and, perfect segue into our golf tournament. So that's September 25th. With the funds that we raise from that, and that will go on to you guys, give folks an idea of where that money's going to go towards. So they donate, they play. What's that money going to do?
That money will go probably between the 2 meals programs, probably be between the soup kitchen and Amazing Grace. It'll buy food. It'll help pay for the staffing that support those programs. For the soup kitchen, I have 2 chefs that alternate because we're open 6 days a week, and we serve a Sunday meal with a church group, but we still have to have staff. And I have 3 dining room managers to run that program. So, as I said, there's no federal or state money in that program, so it really relies on our fundraising or your fundraising helping us. Amazing Grace, I have a director, a warehouse manager, and 2 part-time staff there that run that program, including the backpack program, which is huge. So some of that will buy food. As you know, food is really expensive right now, and we provide really good food. We make, in the soup kitchen, a full breakfast. We have eggs most days. We have a full dinner at lunchtime, which is made from scratch. We don't serve unhealthy food. We have a full salad bar every day, breakfast and lunch. Amazing Grace is just like a shopping store experience. I don't like to propose for any of our food programs that it's less than, if I can't eat it or don't choose to eat it, that I expect the people we serve to eat it. So between our food pantry and the meals program, the food is really healthy and nutritious, low fat, nothing is fried. We have convection ovens, fresh vegetables all the time, and that's what we have at Amazing Grace. I mean, if you came into our shopping experience, it looks like a grocery store. It does not look like a food pantry. And you choose the foods you want by the size of your family. And we have milk, dairy, meat, fish. We have halal food, culturally relevant food, and that we have all the time. So I think that's what's important and sets us a little bit apart from just a regular food pantry, and the fact that we're the largest one in the state.
It also just seems like compassion just runs so deep. I mean, even just hearing you say, if I wouldn't choose to eat this food, why would I expect the people who are coming through our doors to do the same? I mean, that's a level of compassion of not just, well, we're helping, so be grateful for what you get, but more like, we want to treat you and see you like the people that you are.
We do, and the last thing I haven't mentioned is we embedded, going into our 4th year now, we embedded an occupational therapy program into the soup kitchen model through Quinnipiac University's occupational therapy degree program, and the professor is now on our board. We've moved it out of the soup kitchen. It's at a church now down the street, Holy Trinity, where we got a grant to outfit their basement, and it has 2 tracks. It really started to look at, amongst the soup kitchen population, people that are homeless or addicted or have some mental health issues, where idleness and isolation played a key role in their daily lives. And so when the Professor Carlson came to me, I said, those are the 2 things I'm looking, it was during the pandemic, that we really need to work on. Because they've lost their families, they've lost their work, they've lost everything, and they have just trying to eat for the day and find a place to sleep for the day is a full-time job, right? So a lot of our homeless have gravitated to that program, and it has 2 tracks. It has a vocational arts track where they do all kinds of artwork, and then we go to pop-up markets, we go to craft fairs, and they sell their work, and they get 90% of the money, each person. 10% goes back in the program. And then there's a leisure track that we run very heavily 5 days a week in the summer, where we go hiking, we go fishing, we go bowling, they go to the movies, they do other things. And embedded in both tracks is an occupational therapy practice of looking at executive functioning, looking at any kind of physical illness people have and making sure they're connected, looking at wound care, all of those things. And it's been a phenomenal experience. Some of the folks that have gone through that program who were homeless are now housed. They're clean and sober. They're thinking about working. They've been very participatory in the vocational arts program. And now next week, we partnered with Middlesex Hospital. We're starting a medical program. So we have a doctor, primary care doctor, residents coming out once a month doing a half a day of medical care for the homeless. It's a street medicine program. So we're kind of rounding that out. We've done that with no money. We've done it with a private donor. We have students that are either master level or doctorate. OTs have to be doctorate level now. And we had a couple of med students this year. So in the summer, it runs 5 days a week, 9 to 4, with the students, the professor. It'll take a little break in another week, and then the fall students come in, and then the winter students come in. So we're really running that program almost yearly now, and it's not being done anywhere to put an occupational therapy model embedded in a soup kitchen. And it's showing some wonderful progress to the point now where I think it's a fundable program.
Well, I mean, that's all the more reason for people to get involved
in
the tournament. September 25th is going to be here before we know it.
Absolutely.
So we really appreciate you being on the show here. Is there anything I missed or anything else that you think that you should share when it comes to St. Vincent de Paul or our golf tournament coming up?
We're just really thankful for the partnership with Root Center. First and foremost on the clinical level, coming into Middletown with your methadone and treatment facility has been a very important piece for us to have you as a partner. And I function from a partner philosophy. Grew up in a family business, so I'm very pro-business and building partnerships in our community because we can't do it alone. And even though we're an anchor institution, well known, well respected, we still need partners for the pieces that we don't do, and now more than ever it's really important. So I thank you for doing the golf tournament. We couldn't pull that off ourselves. And come on out, have a great day. You'll get a Lyman's pie and, support a really great agency that's very important to the community of Middletown.
Yeah, Maryellen, thank you so much. That's true. You got a Lyman Orchard pie. You got a bunch of other goodies. You got some apple cider donuts, a lunch, after play snack, full banquet dinner, $200 for an individual, $800 for a foursome, and we still have sponsorships available. Or if you'd like to donate to the raffle, you can reach out. We'll have all that information posted in the comments. Thank you so much.
Take care.
Well, we hope you enjoyed this episode of our podcast, Recovery with Root. As always, stay connected with us on social media to learn about when next podcast episodes will drop. You can comment, ask questions, even let us know about future topics that you'd like to see discussed. Until next time, remember, progress is the destination.